Welcome back. Tired feet, get 'em filled. Not long ago, Victoria Beckham was photographed in flip-flops with grossly swollen and red bunions protruding from her feet. But she's not alone. Doctors say that over 80% of women experience foot problems as a result of wearing ill-fitted shoes. Now, the crew and I decided that we would do a little bit of our own market research, so you don't want to miss this. Right, I'm here with a group of ladies who are about to head off into town, and they're obviously all looking very nice. Some are wearing high heels and others are not, so just want to get your feedback, ladies, on does everyone wear high heels?
Yes. Yes. Yeah.
Now, some of you are in flats. Why is that?
So you get really sore feet.
Yeah?
Like the balls of your feet get really sore.
They burn.
Yeah.
They burn.
They burn.
And you get blisters a lot.
Blisters.
Yeah.
That's another thing. Heels, you get stuck. The bottom of the heels get stuck in all the cobblestones in London, eh?
I've seen some women actually, you know, before actually walking to work, they actually have flat shoes on. Is that correct? Do you girls do that?
Yeah, I do it. I actually keep my heels under my desk at work, so.
I have a drawer of shoes at work. I do literally have a drawer of shoes at work, and I wear flats there and then switch when I'm there.
Great.
It's why girls have large handbags, because they will have a couple pairs of shoes.
Yeah. Keep my flats in here.
Okay, because girls obviously look fantastic in heels. Obviously, guys would all agree with this. But obviously, if there was a treatment out there that could obviously relieve some of the pain, would you girls be quite interested in that?
Yeah. Could be, yeah. Depends what it is.
Now, what's this thing called? Is there a thing called Happy Feet? Is like a gel pad or something that?
They don't.
No, they don't. They move all over the place. They're terrible.
Yeah.
What?
Oh, yeah.
Sorry, I was going to say, and
Should
the
we
other thing
cons-
is when you put them in your shoe, they actually push your foot up. So you end up getting blisters on the top of your toes because it rubs.
Okay.
So I don't think they work at all.
Okay. What if I could tell you guys that there was a little treatment that it's a little injection in the balls of your feet that can obviously give you a bit of a pad and obviously relieve some of the pain. It does disappear after a few months, but would that interest you ladies?
Yeah, definitely. Yeah, obviously depend on how painful it might be or the cost. But yeah, definitely worth considering. Because everybody loves, I think, to wear heels, you know, all girls. You feel different, you feel better about yourself, I guess. So.
Great, and all you ladies would agree with that?
Yeah.
Yeah? You look like you're off on, you're out tonight in your Ugg boots still though, but you know, I'm not convinced.
You want to see me tonight.
Instead of buying a gel-fitted pad to put inside your shoes, you can use dermal fillers to plump out the balls of your feet. Doctors are now often using this procedure to cure the path caused by years of wearing high heels. Medics at the Birkdale Clinic in Crosby have seen a 20% increase in the number of women in their 40s asking for this jab. This isn't the type of pain induced by a pair of new shoes, but pain after years of teetering on high heels. The balls of the feet take a lot of pounding in high heels, but some women refuse to give them up. The procedure won't make them feel or look any better, but will certainly protect the nerves and the soft tissue and obviously stop them from swelling. And now, changing topics completely, we're going to bust the myth around fat transfer. You don't want to miss this. Fat. Often considered by many as quite disgusting. But I've heard rumours that it can actually make you look beautiful. Well, we're about to go and explore this myth by talking to Dr. Josh Berkowitz at the Wimpole Aesthetics Centre. Dr. Berkowitz, I've heard the rumours that fat can be injected into the bum or breast. Is this true?
Well, it is true in the sense that fat can be transferred from one place to another, but not that fat, Steve. That's completely the most inappropriate fat for injecting anywhere.
Fat transfer seems to be a very popular treatment at the moment. What's your opinion on this?
Well, I think it's growing in popularity because it's also growing in success, in that the techniques for harvesting fat and the techniques for transferring fat into the desired areas has become much more successful, and in consequence of that, it's growing in popularity.
So, Dr. Berkowitz, I've heard that once the fat's injected, obviously you can lose some of that fat. Now, I've got a plate of fat here, which I'm going to hand to you. And I want you to demonstrate to our audience how much you think a person would actually lose once the fat's injected.
Well, about a third of the fat will disappear. So if I use this block of lard as the example, then by removing 1/3, I keep 2/3, which is the amount of fat that's injected into the new site will survive and transfer successfully. This is provided, of course, that it's been harvested under the right conditions and injected as carefully as it should be by the protocols which are current at the moment.
Now that we understand the theory of fat transfer procedure, we're going to shoot off now and actually see the procedure done by Dr. Grant Hamlet at Cosmetic Medical Group. Is this possible?
Absolutely. Autologous fat transfer is definitely possible, and it's one of the modalities that surgeons and cosmetic doctors will use to reshape the body. It forms part of the body contouring package, if you will. And essentially, it's exactly that. We remove the fat from one area and reimplant it into a different area.
What are the common areas where people have fat transfer?
I mean, there's male and female, and obviously they're going to differ slightly. The female population generally go for fat transfer either to the buttock, where you have sort of like a Colombian buttock lift, or you can have fat transferred into the breast. And nowadays they're doing a cell-enriched fat transfer to the breast, which gives you a better result, a longer lasting result. Whereas with the male side, also you can transfer it to the pec muscles, beef up their chest, basically.
The big thing for me is that, transferring fat from your bum to your face. I mean, it's a weird concept, but, do people have a hang-up on this type of thing? Or?
Well, I suppose you, if you're going to tell your friends, they may do, but it's essentially the same fat. It's coming out of your body and it's being transferred, if you will, to a different area of your body. So it's just moving the monopoly pieces, really.
Well, you can see we've busted another myth that fat can be transferred from one part of the body to the other. But for this fat, all this is going to be good for is to improve my cooking skills.